Hello, good afternoon to everyone present here. My dear faculty members, colleagues, and my dear students, today we are here to welcome on the session of this controlling the cancer in the community. So today we have gathered here for an important and relevant session on the cancer. In association with the Center for Clinical Research, Iihmr Jaipur, because cancer is one of the most deadliest disease right now we are facing, and because of this reason people are losing their lives. The reason is that we are unable to identify these kind of symptoms associated with the cancer in early stage. So even though we are having the advanced technology, we contributed a lot of to develop the biosimilars and certain new drug molecules for the pharmaceutical industry, and right now it is available in the market. So I am privileged to introduce today's distinguished guest faculty, Dr. Naresh Somani, who is a medical oncologist and currently serving as a director oncology and head of the department medical oncology of SCG Cancer Center and founder of the Somani Hospital. With his extensive clinical experience, he not only having that medical expertise but also a valuable practical insights into the realities of the cancer prevention, early detection, diagnosis, and the treatment. So today's topic particularly significant and more significant because cancer control cannot be achieved only the
medicine will be working, you will make it a notifiable disease, properly reportable disease. So whatever the data we have having, whether it's the population-based registry or whether it's the hospital-based registry, they are always incomplete. And if we talk about the common cancers, then as far as the male population is concerned, because the tobacco, smoking related cancers are the most common, right from the head neck cancer down the esophagus, lung cancer, they are the common cancers, and you will be surprised that like the western population, we are fastly catching the colorectal cancer and the prostate cancer. Means it should cure, and outcome of that treatment should be more beneficial compared to the stage to stage. If that is not applicable, that means that cancer is not for the screening. So with these criteria, which are the cancers which can be screened presently with available methods, that is female breast cancer, cervix cancer, prostate cancer, colorectal cancer in both malignancies, and in the high-risk population, oral cavity cancer, and in the high-risk population, with the help of the low-dose CT scan, lung cancer, smoking, particularly tobacco, they are not there. I keep seeing in the society, my surroundings, the disturbing trends for the drugs, for the alcohol, for the addictions which are coming nowadays. And you will also be surprised when the global youth tobacco survey was done. Even I was surprised when I was a part as the principal investigator for that project in Jaipur. The starting age for the tobacco chewing habits in my surrounding in Jaipur city around 20 years back, it started at the age when the students were in the 8th or 9th class. That's a fact. So I believe and hope and I am optimistic that this campus and its students will be away from this. Otherwise, we all understand being the science students that chewing usually doesn't give more than 10 years. Within 10 years, this kind of the pictures, they are not unusual. And unfortunately, there are no cures for these kinds of situations, even with the recent modern treatment, including the whatever the best chemotherapy, target therapy, immunotherapy we can have. But what we can do, this is the leukoplakia picture, oral cavity cancer picture, where the pre-cancerous lesion is clearly visible, and a simple torchlight can detect leukoplakia and things are there. Examination by the colonoscopy is there, or the sigmoidoscopy is there, and transfusion embryonic antigen is there, and the DNA based test is there. and that's the number one cancer, breast cancer. So any other point here that yes, breast cancer can be cured, can be prevented, though treatment is very, very psychologically disturbing. Another important thing as far as hereditary cancers are concerned, when you go back in hospitals and work, please do not allow your system to go for the screening before having a proper counseling. The reason is most of the cancers, they can be taken care of with the help of the surgery only. There is less chemo-preventive treatment. Suppose you are detecting someone's breast cancer, precancerous lesion, BRCA positivity. आपने बोला था ना हम स्टार्ट करते हैं 15,000 रुपये का BRCA होता है. We will offer everyone at the rate of the 5,000 and do it for the hundreds of the population. And 5 of them are the BRCA positive. Now comes the treatment, prevention. What the treatment? The treatment is bilateral both breast removal, simple mastectomy. There is no chemoprevention. How psychologically disturbing it can be. How the lady can take the decision alone without the spouse, without the family decision, and how she will be rehabilitated back in the society, back in the family, back in the personal life, back in the sexual life. That's an important factor. So screening is not like sugar or the blood pressure monitoring or the testing for someone. It needs a lot of pre-counseling. Should be avoided. It should be kept minimum in our life. नियमित एक्सरसाइज करें एंड एक रूल ऑफ थंब होता है फॉर द मेल पॉपुलेशन मिनिमम 45 डेज गुड एक्सरसाइज मिनिमम 5 डेज a week and for a female 35 or 40 minutes 5 days a week. Tobacco seven no, and we all should be vaccinated for hepatitis B and food, drugs. These are the things that we should apply in our habit. We should apply. We should make our system like this, that we have the minimum direct sun exposure, air pollution probably in individual capacity. You cannot do much, but yes, you need to understand it. That it's also leading to the certain subtypes of the lung cancer, especially the adenocarcinoma, pre-cancer lesion. You can make the programs, you can treat them, and legislation. I wish and I hope that at least one of these students gathering will go in that position in their life, in their career, where they will be applying, make the rules for legislation for the non-communicable disease and will be able to serve the society in much better way. Cancer education, yes, it's everybody's job that we keep teaching, keep talking, keep understanding in this particular field, and through the diet and the lifestyle. एक अच्छी बात ये है कि जो भी मैंने फैक्टर्स आपको बोले हैं लाइक अल्कोहल, टोबैको, ओबेसिटी, सेडेंटरी लाइफस्टाइल, फूड्स, fruits, vegetable, they are in general, they are not for any particular cancer. Obesity related cancers like esophagus, ovary, hepatocellular cancer, stomach cancer, gallbladder cancer, colorectal, prostate, pancreatic cancer. In general, they are preventing all sorts of these cancers. HPV vaccine for the cervix cancer, it's in the scientific term, basically like HPV 16 and 18, which are the most important for the positive of this cancer. It can be prevented. Partners like lip, buccal pneumonia, MDA 2/3 of the tongue. So these we call as classically the oral cancer. So obviously, कंठा कैंसर तो कंठ पे छाला होएगा, कंठ पे घाव होएगा. बकल में बोला तो पहले ल्यूकोप्लेकिया, वाइट पैच या रेड पैच होता है, एंड फिर घाव छाला हो जाएगा, कई बार ब्लीड भी करता है. लिप का कैंसर सेम वो रहेगा. So any lesion which is persisting beyond 2 or 3 weeks and not being healed after removing that factor or the etiological factor, it should be suspicious, especially in the high-risk population like smoker or alcohol consumption. And when the both factors are there, it is not 2 plus 2, it's a 2 plus 2, 5. So suppose if I am having the both habits, like tobacco chewing also, and on top of that I am having the good habit of the alcohol also, then there is a more habit. Now coming to the posterior part symptom, so one will be feeling the lump, irritation in the throat, lump feeling, dysphagia comes, difficulty in eating, and sometimes lead to the weight loss also. Another classical example is the ruffled pain in the ear, base of the tongue cancer, posterior 1/3. As the nerve supply is inarticulate there,
Then the person comes with a referred pen in the ear. There is nothing wrong in the ear. It's the case of the tongue having the same nerve supply and the tumor is there. Nasopharynx is the separate part. Each patient, especially the youngster, is the cancer of the youngster because it's the Epstein-Barr virus related cancer. And they usually present with the bull's neck.